Welcome to today's School-Based Health Center peer-to-peer listening and learning sessions. We're so glad that you've joined. Next slide. We're going to begin today's session by going through a couple housekeeping items, explaining how to participate in the session and some ground rules. The bulk of the time today will be spent in discussion, focused on the topic immunizations. We'll conclude by sharing resources, and then you'll be asked to complete a short evaluation. Next slide. I'll start by introducing my organization, the School-Based Health Alliance. We work to improve the health of children and youth by advancing and advocating for school-based healthcare. Next slide. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students already spend the majority of their time, in school. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are better managed, behavioral health issues get quick, expert attention, and we all know that healthy students make better learners. Next slide. My name is Erin Sullivan, and I am a Senior Manager of Research and Evaluation at the School-Based Health Alliance. I'm joined today by two of my colleagues, Paula Fields and Andrea Shore, who will be monitoring your discussion in the chat box. Next slide. We have no financial relationships to disclose today. The goal of today's session is to provide a space for school-based health center leaders, sponsors, staff, and other stakeholders to discuss challenges and strategies related to operations during the COVID-19 pandemic. Today's discussion is specifically going to focus on immunizations. There are no right or wrong answers to the questions that we're going to ask today. We're interested in learning about your individual experiences and opinions. My colleagues from the Alliance are joining to take notes, and we'll also be recording so that we can review and analyze today's discussion. We'll exclude names and other identifying information from the dissemination of this analysis, so your responses will be confidential. Your participation is completely voluntary, and you can choose not to participate or to leave at any time. However, in support of improving patient care, CE credits are provided through a partnership with the Weitzman Institute and Community Health Center, Inc. If you'd like to obtain CEs, you'll have to attend the full session today. Participants must also complete the session evaluation in order to receive CEs. This will be shared in the chat box near the end of the session. Next slide. All attendees are in listen mode only for now, but we want to hear your questions and responses. So if you'd like to add your comments through the chat function, please select all panelists and attendees before sending the message so that everyone can see it. Based on what's shared today, we'll invite certain participants to unmute so that they can provide more detail about their responses orally. Next slide. We'll be using an online tool called Menti to support today's discussion. Menti will allow you to share your responses anonymously through a web browser, and it will turn these responses into displayed data visualizations to facilitate a discussion. In order to share responses and see the responses of others, we suggest submitting your Menti responses either on a smartphone or on a web browser on a separate screen if you have dual monitors. After writing your response to each question, make sure that you hit the submit button so that it will include your response in the data visualization. When you're ready to proceed to the next question, hit the next button. For some of the questions, you'll be able to submit multiple responses. Once you have said everything that you'd like to say, please click submit and then next question. Although we'll continue to discuss your responses, clicking next question ensures that we can capture all of the responses to each question. If you'd like to elaborate on what you write in Menti, you can do that using the Zoom chat feature. After everyone responds in Menti, we'll take a couple minutes to verbally and discuss each question and what you wrote. Next slide. I know that was a lot. Does anyone have any questions before we get started? Okay. Emily, you can pull up the Menti screen. Great. So using your smartphone is ideal, or a separate browser on your computer. Pull up www.menti.com, which you can see at the top of the screen here, and enter the code 214-11561, which you can see there. And then we'll ask that you please share your name, role, organization, state, and zip code, and press submit. And you can see that your responses are starting to show here on the screen. And if you have any questions about how to log into Menti, you can enter them into the Zoom chat. Great, already some diversity in terms of where respondents are coming from. I see New York, Illinois, Ohio, Iowa. This is great. Just give you a couple more moments to enter information about yourself before we move on. And again, you need to open up a browser, either on your phone or on the screen, and go to www.menti.com and use the code that you see here in order to enter the discussion. Great, I'm seeing a lot of different states and organization types represented, which is great. Okay, we're going to begin today's discussion by talking about general vaccine administration at school-based health centers. So Emily, you can proceed. So the first question is, what words come to mind when you think about immunizations delivered by school-based health centers during the COVID-19 pandemic? And again, you can enter these in through Menti and make sure that you hit submit so that your response is recorded. So you can see here that the words that are mentioned most often are going to show the largest. So I'm seeing challenging is coming to the forefront, necessary, difficult, delayed. Thank you for sharing. Seems that more and more people are saying that immunization delivery has been challenging but necessary. Frustrating, I see, is becoming larger, meaning that more and more people are saying that it's been frustrating. I'm seeing barriers. It seems like challenging is really at the forefront here. It's the center word. Difficult, delayed. Great, thank you for sharing. I'm going to move on. Next, I want you to fill in the blank of the sentence. Compared to this time last year, it is blank for school-based health centers to administer vaccines to patients today, ranging from easier to more difficult. And remember, there's no right or wrong answers. So even if you see something on the screen, I want to hear from you and your personal opinion, even if it differs from those of your colleagues. So I'm seeing a lot of people express that vaccination administration is much more difficult today compared to this time last year. And a couple people have expressed that it's a little bit easier. Give you a couple more moments to answer this question. Great. So it seems like for most of you, it's been either much more difficult or a little bit more difficult. And for some, it either hasn't changed or it's been a little easier than this time last year. And we'll dive deeper into these responses as we move forward in the conversation. Okay, great. Next, please, Emily. So I saw that a lot of you mentioned that there's been some challenges in vaccine administration. So now I'd like to dive a little bit deeper into that and ask you to share some of these challenges and more specific details about that. And please use the chat box if you have any questions about how to use Menti, but you should be able to submit a response and then click submit. And you can submit more than one response to submit multiple challenges. So it seems like 2 of you have said that by students not being in school, that's a challenge. Yeah, access to students seems like a big one. Children not at school, schools are remote, students are remote learning. I'm seeing also some challenges related to parents. Parents are misinformed or parents are hesitant. Some issues with accessing vaccines, it seems like, vaccines not being housed on site. Difficulties with billing. Great. So related to parental hesitancy, we have fear of vaccines. A lot of challenges related to access to students since schools are closed or operating on a hybrid schedule. Great, thank you. I'm going to move on. So please hit next question. So next, it was great to learn about your challenges, but in response to these challenges, what strategies are school-based health centers in your state employing to overcome the challenges that you mentioned? And again, once you can submit multiple responses here, please just ensure that you hit submit after you write each response so that it all includes in the data visualization. So I'm seeing a lot of online strategies like online consent forms, Facebook Live. some mobile clinics, vaccine-only clinics. Working with the Department of Health. Better communication with the health department. Reaching out to individual families. Thank you for sharing these. Expanded hours after school, direct outreach, targeted outreach, email reminders. If Meg Kane is on the line, I know that you've joined. If you could unmute yourself and share some of the strategies that you've employed at your school-based health center.
Hi, did that work? Can you guys hear me?
Yep, we can hear you. Thank you.
Yeah, my name is Meg Kane. I'm a pediatric nurse practitioner at a school-based health center through Nationwide Children's Hospital in Columbus, Ohio. And we've had a lot of different strategies. Some have been more effective than others. Some of the things that we have tried in terms of kind of increasing our patients' access to our vaccine clinics have been kind of some of the things that have been mentioned here. So we've done a lot of direct communication with our patients and their families. We've done a lot of we have lists of patients that we've seen previously, and we've called them and offered them vaccine opportunities while simultaneously setting up vaccine clinics in their neighborhoods, sometimes through the use of our mobile clinics, which are converted RVs that we just drive right up and park in the area and then offer to kind of service the families that way. And then other times through our school-based health centers, even though they don't have school in the buildings, we have been seeing patients in the buildings. We've also tried to sync up our vaccine opportunities with the other events that are happening that are school-based. So be those the feeding clinics or the kind of Chromebook distribution opportunities, things that we know are already drawing up, kind of drawing the community's attention and just trying to make it as convenient as possible for an already very stretched population to receive their vaccines. I think, I don't know if Tiffany is also on the line. She can kind of speak to some of the ways that we've leveraged this opportunity at a higher, more kind of strategic level, if possible. She's also with our organization and does a lot of our program management.
Great.
Hi, yes, I am on. Can you hear me?
We can hear you.
Awesome. So yeah, Meg, I think you mentioned a lot of it. One of the other opportunities that we kind of took advantage of to connect kids with vaccines is so as our school districts had been largely virtual just up until probably a week or so ago, but they, through community partners, created what they call learning extension centers. And so there's hundreds of them located throughout the county where kids can go to access the internet, food, things like that during the school day. And so we partnered with those learning extension centers and have seen some success in terms of reaching children that way. And so just thinking about where kids are, where families are sending their children in a comfortable and safe space. And we've been able to create just like we call them roving vaccine clinics, where we essentially take vaccines from our school-based health centers and essentially in a cooler in a bag and take them specifically to sites. So that's really allowed us to expand our offerings of vaccines and where, knowing that with the whole reason that we are all in schools, one large reason is to break down that barrier of transportation and access for kids. And so just being able to take vaccines to where children are, we've been able to figure that out quite extensively.
Thanks so much for sharing that. And I know that a lot of people mentioned that access to students is a main challenge. So if anyone has any other strategies that have been successful or unsuccessful, an important lesson that you'd like to share, please speak up in the chat box or unmute yourself and share that.
If someone would like to unmute, you'll just have to identify yourself in the chat box, and we'll give you that power. Thanks.
Thanks, Emily. Maureen Murphy, if you're on the line, could you unmute yourself and share some of the strategies that you've employed? Maureen Murphy from,
Yep.
Great.
Yep. Good
Hi.
morning or good afternoon, everyone. I think what we have done was the initial curbside that a few of other people had suggested as well. But one key component that we really found to be super effective, and I suppose across the country, but particularly in the Detroit area, the very vulnerable population has really been hit with the whole pandemic and the lack of food and basic necessities. And so we took the curbside approach, but we use that 15-minute period to really have our social workers interdiscipline with us and work with the parents. Number one, to kind of, hey, how was our process? Did we nail it? What should we have done different to make you feel more effective? Kind of like a bridge back to our clinic. But more importantly too, and just as equally important, was the assessment of the social determinants, providing them with resources, whether it be for gas or electric or food. And we did a survey, and 42% of our population that we utilized said that they had at least one social determinant issue that was pending right then and there. And we provided them, we couldn't advertise for food because we didn't want that to be like the draw for why people came, but we offered everybody food that came, and all but one car took that food, and we're very thankful. So I really want you guys to hear from me that I think that giving immunizations might be a small component of healthcare that we give, but we really can incorporate, should and could incorporate that assistance to social determinants. So that's kind of my big aha moment with the whole program.
Thanks so much for sharing that. While you were speaking, we had a question about the vaccine in a box concept. Just for more details about it, if Meg or Tiffany, you could ask to unmute yourself and share some more information.
Oh, this is Meg. Sorry, can you guys hear me?
Yes.
Yeah, that was me. I made that comment. So we just basically dedicated a lot of our resources to making sure that if a community partner or a stakeholder or, one of our school nurses or anyone, just because we also partner frequently with, our kind of our homeless shelters or daycares, et cetera. So anyone in the community felt like they had a need for a vaccine clinic that we could have really at very short notice. With our partnership with the health department and the hospital, easily deploy all the supplies needed to do a vaccine clinic with very little notice. So I think Tiffany mentioned that we have portable coolers that we will use. We have data loggers and thermometers that we use to constantly monitor the temperature of our vaccines so that we can stay in compliance with, the manufacturer's requirements. And we have even down to like paper forms if we're not able to utilize internet at whatever site, which has happened. It's not my favorite, but it has happened. So we just make sure that we have as few barriers as possible to accommodate all environments in which we have a high level of need so that we can just go to wherever there is a need and just make sure that we are able to vaccinate as many people as possible, especially if it's the partner that's asking for it. You want to be able to just deliver that. And because obviously that does beget further visits, right? So clearly we want to provide more preventive care whenever possible, but often that will start with an ask for a vaccine clinic. So, and we can just work out the rest of the details afterwards, but if we can show up and provide people what they need at that day, we can return later with more resources and get them other things that will help, improve the situation.
Great, thank you so much. There also seems to be interest in the legal aspect of providing vaccinations off-site. If anyone has been doing that and can share a little bit more about that strategy. So again, the question was vaccinations off-site, just more information about how you're implementing that, the different criteria that go into establishing that. And please just ask Emily to unmute you so you can share.
So Erin, we did ours in our parking lot, so we were still on school grounds or in clinic grounds, but we did do an outreach for flu shots. And for flu shots, our legal department gave us the go-to to go anywhere at any time. And I don't know the difference, but there was a significant difference of whether we were giving out flu shots only or full immunizations.
Mm-hmm. Thank you. Has anyone had a different experience or a similar experience that they can share about vaccinations off-site? So that could just be in the parking lot or through a mobile clinic. Okay. Has anyone created specific tools or resources to prepare for vaccine administration or to assist with that they could share?
Erin, did you just ask about a toolkit?
Toolkits, resources, anything that's been created specifically to overcome challenges related to vaccine administration during COVID.
So I actually wrote up using the logic model so that we could replicate this again and again if possible. And so we wanted to be very specific on what would happen. Like Meg was, I think, talking about what would you do if the IT was out and how to prep a chart and have the backup immunization records on hand and how to have it ordered and what they would need if all of that happened. So I did create a little toolkit that basically was the premise of what you should think about, even if it's like talking to your municipality. What about traffic flows? And these were more for a curbside event, but certainly willing to share that.
That would be great if you could share after the session. I'm sure other people would love to see that as well. Another question that was posed is, how did you get approval from your state Department of Health given vaccine regulations? So going back to legal issues, if anyone can speak to that question. And please just ask Emily or one of the panelists to unmute you. So again, the question was, how did you get approval from your state Department of Health given vaccine regulations?
This is Meg. We went through the process to become a VFC site within our state, Vaccines for Children site. I'm not sure if that answers the question, but I think that's what they're asking.
Yeah, is there any other details that you could provide about that, Meg?
Yeah, it is quite, it is an ordeal, but it ends up being, worth it. So we have, storage and regulation and, all sorts of like equipment stuff that we have to maintain, which is its own, whole can of worms over here, but it ends up, we correspond quite regularly with the Ohio Department of Health to ensure that we're compliant, and we report out quite regularly. But that does give us the flexibility to give just provide vaccines at, no cost, or we do stock private vaccines as well, but it does give us the flexibility to serve the population that that we serve.
Great, thanks for sharing that, Meg. It seems like a lot of people, it looks like in the chat, have questions about just getting through various regulations and how to work around that. So,
we have several team members who can share how we went through the process and what is involved, and I'm happy to connect anyone who's interested in learning more.
Great, thank you. Christina, could you ask to unmute yourself and share some of your strategies that you've been employing at your school-based health center?
Yes, can you hear me?
Mm-hmm.
Okay, hold on. I am having trouble. So can you hear an echo? Hello?
Sorry, I was muted myself. Yes, we can hear you.
Okay, I'm sorry, I'm hearing an echo. Let me figure it out because my computer's not working and I'm talking on my phone. Can you give me a sec? I'll come back.
Sure, we'll call you back later. Thank you. So the next question is related. Emily, if you could move to the next question in Menti. And for all of the respondents, please just click next on your Menti screen. But the next question is, what lessons have school-based health centers in your state learned through employing vaccine administration strategies during the pandemic? And while you're entering these in Menti, I think, Christina, are you able to share now?
Yes, I'm here.
Okay, great.
What was the question that you have for me to answer, please?
Just about specific strategies that you've employed with school-based health centers in your site overcoming COVID-related challenges.
Thank you. Our state health department provided guidance and vaccines for all the sites, not only school-based health centers. We also form part of the Vaccine Equity Task Force to help develop resources. And I put the website in the chat where we have defined different subcommittees for our communication and making sure that the community will feel comfortable vaccinating when it was their turn. In addition, we are part of another task force that is reviewing applications for funding, where several of the foundations in Colorado got together to support community-based organizations to provide vaccination. So we're also part of that work. So it's between working with the health department and then immunization specific task force and school-based health centers. I think everybody else are already covered on the drive-through efforts. And one of the challenges that we're still trying to help the sites with is on registrations and workflow for when more vaccination becomes available.
Great, thanks for sharing that. And just continue, if you haven't already, to please go to Menti and share lessons that you've learned throughout this process of trying to administer vaccines throughout the pandemic. I remember that parental outreach and parental hesitancy was another challenge that was mentioned specific to administering administering vaccines throughout the pandemic. if anyone has found a strategy to be particularly successful in overcoming that challenge, if you could share. Another challenge mentioned was getting families in the door or getting them to the curb. Jasmine, if you could unmute yourself and share about strategies that you've employed.
I'm sorry, could you repeat that question, please?
Yeah, I was wondering if you could share some of the challenges mentioned early on in the discussion were related to parental outreach and getting families to the door. If you could just share some of the strategies that you've engaged to overcome those challenges and others, that'd be great.
Sure. So one of the issues that we've always experienced, even when we were on site and not in this COVID environment, was getting parental consent. And so one of the strategies that we were able to employ was actually to purchase DocuSign and begin using an electronic consent to get parental permissions for providing services and providing vaccines for students. So for instance, we hosted a vaccination clinic for high schoolers. And so the parents were comfortable with, those individuals coming to the site alone, but we still needed those electronic consents, which was really important. And our compliance department as a federally qualified health center was pretty much clear that the only way we were going to be able to use electronic consent is if we used a third party program such as DocuSign that could confirm that the person who was signing the document was the legal guardian of the parent, just in case in the future we needed to provide that documentation. And so that was one of the best strategies that we were able to employ to get our consents quickly, and then be able to provide the service and not allow consenting to be a barrier.
Great, thanks so much. I see someone in the chat box mentioning that they also use DocuSign and it's been effective. Has anyone else administered similar or different strategies related to parental consent or parental hesitancy? Christina? Emily, could you unmute Christina? She mentioned that she has something to share.
Thank you. In addition to what Jasmine said with DocuSign, what we are learning that one of the big FQs here is doing is adding in their consent form, adding the ability for parents to check consent for follow-up later on. And then what they're doing, actually one of the students on the youth advisory board is doing this, where they are reaching out to parents through the constant contact. And I think this is important because it's not as expensive as DocuSign is. And parents, the student is being able to reach out to parents for reminders about appointments. And they also added a button in the consent form where parents can request an appointment, or they can check also permission to be approached later on. And this is something that has increased parent participation by, I can't remember the exact numbers right now, but that's something that we're just learning about, and we'll be putting together for our conference.
Great, thank you. I know that Kimberly also asked to unmute to share.
Hi, yes, can you hear me?
We can hear you.
Okay, so we've also been using electronic signatures. It has been challenging though, just because there's very low electronic literacy among many of our families. So we've now been asking whether they have an iPhone or an Android, if they have either one of those, and we've created step-by-step instructions with pictures on how they can electronically sign the documents. And we have it in English and Spanish. And so when we email the consent form to the family, we attach those instructions, which has definitely helped. It's just a small step, but it's definitely made a difference because it can be confusing to sometimes sign these forms electronically.
Great, thanks so much. Has anyone, so Jasmine just asked the group, does anyone do a quick screen with patients during immunization appointments to identify other needed services? So I'd like to hear points about that question. So the question is, does anyone do a quick screen with their patients during immunization appointments to identify other services patients may need? So if you have anything to share, please just ask to unmute yourself. Yes, Kimberly, go ahead. Emily, could you unmute Kimberly?
So I'm in a high school, school-based health center. So for every student that we see once a year, we have them complete a behavioral health history that screens for food insecurity, depression, anxiety, substance use, academic failure, sexual activity, bereavement, violence, safety. So we do that for every single patient that we see, even if it's just for a quick vaccine appointment. If they have privacy at home and are able to do that ahead of time, we can sometimes do a telehealth visit ahead of time just to limit the amount of time the patient is physically in the health center, but often there's space issues and privacy issues. So we just do that at the time of the visit. And we've definitely picked up a lot and made a lot of mental health referrals. So I think that it's been definitely a way to identify other issues that are going on with the adolescents.
Great. Thank you so much for sharing. I'm seeing a lot of people in the chat box as well saying that they also screen. So for the sake of time, we're going to move on. We're going to shift the conversation to discuss the COVID-19 vaccination specifically. So if you could hit next on your Menti screen if you haven't already to answer this question. Are school-based health centers in your state preparing for the administration of an age-appropriate COVID-19 vaccine? A lot of people aren't sure, it seems like. A couple yeses. Thank you for sharing. So it seems like the vast majority aren't sure about preparation for a COVID-19 vaccine. And some of you are preparing. Okay, Emily, can you move on to the next question? So among those who shared that they are preparing, in what ways are school-based health centers preparing for the administration of an age-appropriate COVID vaccine? And you can submit as many as possible. Just make sure that you hit submit on your screen after you finish typing. I see you're unsure. Okay, I see trainings, improve workflows and the ability to register patients, introducing the idea of the vaccination.
Chat, someone shared that they're talking with all of their patients about the vaccine.
Interesting. Could that person ask to unmute yourselves and share more about that? So the person who mentioned that they're speaking with all of their patients about the vaccine.
And it looks
Hi.
like you're unmuted now.
I think that's me. This is Allison Martin.
We can hear you.
Yeah, I'm a provider, and in the course of conversations with parents, to whom I'm speaking a lot now for historical information for physicals, I mentioned the possibility of the vaccine. We don't have it for children yet in New York, but it's on the horizon. So it's just sort of planting seeds again to overcome the vaccine hesitancy that people have. And in our particular community, many people have hesitancy about the flu vaccine. So I'm anticipating similar hesitancy with COVID.
And what have the responses been like as you've planted that seed?
People listen politely and say that, indicate that they will consider. But across the board with that response from patients and the outcomes, and this is purely anecdotal, haven't done any studying, but I'd say, maybe you get a 5% follow through on that on the first try.
And sorry, could you explain what you mean by follow through on the first try?
So I see school-based patients. I also see other patients in other clinics in our organization. And when I mentioned to somebody in a televisit the idea that they're due for a flu vaccine, they may indicate in that televisit on the phone, okay, I'll consider it. When they come to the clinic for the actual in-person visit, for whatever that may be for, at that point, they will decline or may decline.
Okay. Thanks for
sharing.
sharing.
It's the shot in the arm. Yeah.
Mary, I believe that you had a question if you wanted to unmute yourself and ask. No? Mary Otwell? No? Okay. I'm seeing trainings as a way that people are preparing for the COVID-19 vaccine. If someone, whoever wrote that, could ask to unmute themselves and share more specifically about what kind of trainings.
Erin, this is Maureen. I know that our state school-based health centers has been collaborating with the actual health department and providing what we call lunch and learns, trying to get everybody on board with what the administration protocols are, how the storage can be handled, what's the best way to process these. And there is a high anticipation, at least the feeling I get, is that they would anticipate that the school-based health centers in Michigan will probably assist and help in administration.
Great, thank you. Christina, I believe that you wanted to add something as well.
Yeah, thank you, Erin. We are part of the just-in-time COVID ECHO, and the audience are administrators and everyone that works in the school and school health and school-based health centers. So similar to what was mentioned right now, it's providing EPI information to school staff on vaccine numbers in the state, and just preparing and looking ahead into preparation for the summer and for what the vaccine is available. So we're covering topics from behavioral health and how COVID is impacting the staff and students right now. So it's not just vaccination, but everything that is related to COVID.
Great, thanks so much. Just for the sake of time, we have about 10 minutes remaining. I'm going to move on to the next question in Menti. So I know that a lot of you mentioned specifically you're unsure of what preparation is happening in preparation for a COVID-19 vaccination. And just for all of you, what challenges are school-based health centers in your area facing in the preparation of the administration of a COVID-19 vaccine? Please share via Menti and make sure that you hit submit. Okay, vaccine availability. And again, you'll see that the responses that are submitted the most frequently will display the largest. So it seems like availability is a big one. Limited supply, misinformation, vaccine hesitancy. And again, please share as many challenges as you'd like. Just make sure that you hit submit after writing each response. So it seems like vaccine hesitancy, vaccine concerns is popping up, as well as supply and availability. Misinformation, funding. Great, thank you so much. Just gonna give a couple more moments and then move on. Lack of trust, someone mentioned. Emily, can you move to the next question? Please hit next on your Menti screen to go to this next question. So related to the last question, I'm wondering what supports are in place to assist school-based health centers in the preparation of a COVID-19 vaccination. So collaborations and partnerships are supports that are mentioned. And if you don't currently know supports that are in place, you could also share in the chat box what supports you would need that maybe you don't have right now. So supports that are in place that are mentioned are partnerships, collaborations, technology. So it seems like the human resource support is a really big one. And again, if you want to share supports that you don't have right now, but you would need, if you could share that in the chat box, that would be also helpful to hear. So if anyone could ask to unmute themselves quickly about partnerships that have been particularly helpful. I see that partnerships is mentioned quite frequently about supports that are in place. Nadira, I see that you have your hand raised. Emily, if you could unmute her.
Can you hear me?
Yep, we can hear you.
So we've partnered with the health department as well as the school system. And so the school system really helps us with pushing things out. So for instance, say that our school-based health center wants to host a vaccine clinic or something like that. We partner with the school system. What they'll do is they'll put it on the school district website so that all the families in the city, we're in a small city, it's not a big city. So all the families in the city will know that we're going to host this clinic, and so the word can get out. And we also partner with the health department so that if we have anything, we can ask them to push things out for us too. And so that way everyone in the community knows that our school-based health center is hosting this event, and that we will be giving vaccinations during this event. For instance, just a few past week, many students in the district did not have their Tdap vaccines. And so we worked with the school district to push that information out, saying that we will be hosting a Tdap clinic, so that way families know, hey, please come get your vaccines for your children. So.
Thanks so much for sharing that. Just for the sake of time, we only have a couple minutes left. I'm going to move on to our last question so that we have time for the evaluation. So our final question of today's discussion is, in preparing for the COVID-19 vaccine, what are school-based health centers doing to earn the trust of groups that have been excluded from or exploited by the health system? Please make sure that you hit submit after typing in your response. So I see collaborating with community groups and churches, which was also mentioned as a major support in the last question. Communication, doing outreach, validating feelings, believing experiences, not pressuring people, which really speaks to the vaccine hesitancy that we discussed. Acknowledging past inequities. Jasmine, if you want to quickly ask to unmute yourself and share.
Sure. I wrote in the chat, but I sent it to the wrong person. You know, for our particular organization, we have a workforce that is representative of these groups that have been previously excluded and or by the.
Great, thank you. So I see meetings with school staff. Thanks so much, everyone. I know that we're at the end of our time. So I'd love to talk more about what you're sharing, but unfortunately, we're at the end of the session. So we are going to share an evaluation link. If you could please take a couple minutes to open the link and evaluate this session so that we can improve future content. And if you'd like to receive CEs for today's session, just a reminder that you will need to complete the evaluation. Emily, if you wouldn't mind just ending on the slides with the resources. So these are a couple resources that we'd like to share with you. And again, thank you so much for participating today and for sharing your challenges and strategies. was really great to hear about everything that's happening nationwide to continue to support students. So that concludes the session today. Thank you again for your time, and looking forward to working with you more. And please again, make sure that you complete the evaluation that was sent and let us know if you need any support. The evaluation will also be emailed. Oh, sorry, I was mistaken. The evaluation won't be emailed. We'll only be sending it via the chat. So please make sure that you're able to access it here and let us know if you need any support doing so. So once you submit the evaluation and access it, feel free to sign off, and thank you so much again.